right? There's something to the placebo effect, right? So if that is a real thing, if you can convince your body that it's got the medicine that it needs and it starts to heal, even though there's no medicine, there's got to be something that is working against you as well with the wrong mindset, right?
Look, it's funny to me to hear people rediscovering the placebo effect now. I wrote a book in 1983 called Health and Healing. I had 2 chapters in there on placebos. And what I wrote is that the greatest problem is that when we talk about placebos, it's in phrases like, how do you know that's not just a placebo effect? The most interesting word there is just.
Right.
Or we have to rule out the placebo effect.
Right.
We should be ruling it in, man. That's the meat of medicine. That's pure healing from within, mediated by belief, unmixed up with the direct effects of treatment. That's what you want to make happen more of the time.
It just is a mind fuck for a lot of people because they're like, how am I tricking myself into getting better? Why can't I just do it?
Because that must have something to do with the structure of the brain, that the part of the brain in which our will doesn't connect directly to the machinery of the body, to the autonomic nervous system. So you have to find some way of getting around that. One way is to project belief onto something external and then let it work for you.
Yeah. But that's so strange that the mind works that way. It would seem like, wouldn't it be an evolutionary advantage just have it at access?
Sure, that'd be nice. But that's the same thing. It's a similar problem to why can't you just get high without taking a drug? The high is in your brain, not in the drug. The drug is a trigger that releases it. Why can't we just sit down and say, well, I'm going to be high for the next 10 minutes? It's the same thing. We don't have access to those controls.
It just seems like that one, though, healing and getting better, that one seems like it's something that we should as a culture concentrate on. Yet
for sure
what we really concentrate on is actual medicine.
But one way to concentrate on that is by giving people greater confidence in their body's ability to do that. And doctors have great power to do that because patients project a lot of belief on them.
Right.
I've had many patients over the years who said that the most important thing I did for them was that I was the only doctor who told them they could get better. I mean, astonishing.
Yeah. Is it because doctors are just seeing too many patients and they're overwhelmed and they got legal bills and they have...
I think I've thought about this a lot, and there's also the negative side of this. I've seen there's something called medical hexing, in which doctors say things that actually interfere with healing or cause people to get worse. And I think a lot of this is done unconsciously. So here's one of my thoughts. In their training, doctors see a very skewed sample of sick people. They see very sick people in hospitals. And in that group, healing is less likely to happen. But if you look at the total spectrum of illness, the vast majority of things get better on their own. So I think, observing in yourself, wound healing is a good one to start with. To get greater confidence in your body's ability to do things, that's really valuable.
So, but this, obviously, you're not talking about catastrophic injuries. You're just talking about general wellness.
I think even in the case of catastrophic injury, this stuff operates. I worked a lot with hypnotherapists over the years, and one of my colleagues did a lot of work in training paramedics to be really careful about what you say around unconscious people who have been massively injured. If a paramedic takes an automobile accident victim and they're putting them in and says, this one's a goner, that is a bad thing. The unconscious mind hears that. And on the other hand, you say something opposite to a person. You can see cases where you can stop bleeding in unconscious people severely injured just by giving them suggestions.
Whoa.
Yeah.
So when you're saying someone's a goner, you trigger stress or you trigger helplessness? Like what is happening? Well, to
have a medically trained person tell you that you're not going to live, that's a curse.
Yeah.
It's a medical hex.
How strange is it that sometimes your life is hanging on the border of you believing you're going to be okay and you believing you're not going to be okay?
So you want to be very careful about, whose hands you place yourself in.
Yes.
You never want to stay in treatment with a doctor who thinks you can't get better.
A negative doctor.
Yeah.
Well, doctors are just like every other occupation. There's people that are really good at it and are really concentrated and focused, and there's people that are half-assing it.
Well, the ones I train through our University of Arizona Center for Integrative Medicine get it. We've graduated about 1,600 physicians now from very intensive training. They're in practice all over the country teaching other people. This is a good thing.
Now, when you say integrative medicine, when they're in practice, are they essentially general practitioners?
No, we've trained people from all specialties. Any specialty you can name, we've trained them.
So orthopedic surgeons,
neurologists, dermatologists, anything you can
whatever
name.
It is.
Yeah.
And so you tend to look at them
we teach them all the things they didn't get in medical school: nutrition, mind-body interactions,
Right.
strengths and weaknesses of alternative medicine, herbal medicine, all that.
Like, say someone comes to you and maybe they have a bad case of psoriasis or some
Yeah.
autoimmune issue like that.
Prime target for mind-body medicine, for traditional Chinese medicine, which often works well in that. Dietary change, put people on an anti-inflammatory diet, use of natural products that reduce inflammation. So there's a wide range of things to choose from. And this does not reject conventional treatment. You know, we may use conventional medication, but if you do, I recommend using the lowest dose of the least potent agent. Start off with that, and you can ramp up if you need to.